Everyone, welcome to episode 5 of our How to Become a Doctor series. If this is your first one, we do encourage you to go back and listen to the first 4 episodes, but these episodes can stand alone, so you can listen to it on its own. Each of our topics are different. This fall, we've been able to do 5 different topics. We are going to continue this in the spring, so keep your eye out on our Instagram page about the announcement of those dates for the spring. It'll probably be a similar thing when we do it on an afternoon, probably Wednesday afternoon, but we will record it if you have class time. But just to go over the other weeks, week 1, we went over the competitive applicant being well-rounded. Week 2, we did timeline and MCAT, DAT, OAT prep. Week 3 was what resources can I trust and what ones not to trust. Our last episode was gaining clinical experience. And this week, we will be talking about which schools should I apply to. So once again, just if you have any feedback for me or Mr. Bowen, you can email me at mduris, MDURIS2 at lsu.edu, or you can email Robbie as well, rbowen, RBOWEN at lsu.edu. If you have any ideas for the future of topics you'd like to hear or any feedback about how we can make it different, let us know. We want this to serve you. But with that said, let's start. So this question, what school should I apply to? The first thing you want to ask yourself is, what do you want to be doing with your life? What do you want your career to be? Because that's the bigger question, right? You want to start with not what school can you get into, but what do you want to be doing for 40 years of your life, waking up 40, 50, 60 hours a day doing it. And so we encourage you guys, get out into the field. If you're interested in being a dentist and a physician and you're torn between the two and you're a freshman trying to figure that out, go spend some time in a dental office, go interview a dentist, have lunch with a dentist, go, work in a hospital setting and imagine not, which one do you want to go to, what school do you want to do, but what job do you want to do? And that's going to be helpful, getting out in the field, getting that experience. And once you've kind of figured that out, a lot of you guys are more sophomore, junior level, and I want to be a dentist, I want to be a physician. That's good because you need to have a good reason for that, because you will be asked that in your interview. You will be asked that on a personal statement. So you start with the program, dentist, podiatry, optometry, that kind of thing. But then you get to that, you're like, all right, well, I want to go to medical school, I want to go to dental school. What schools do I apply to? So, well, starting with medical school, there's 2 big programs, philosophies of training out there: allopathic medicine and osteopathic medicine. You guys are probably more familiar with allopathic medicine. That's the traditional MD, medical doctor degree. But there's also DO, Doctor of Osteopathic Medicine. You've probably been to some DOs in your life. It's a very growing field. There's not that much different about them in one sense, because they're both 4-year medical schools. You match them to the same residencies. They do the same jobs. So at the end of the day, you don't need to sweat so much, because career-wise, you will land in similar places. The difference between MD and DO is the philosophy of training in their medical schools. So we have a tab on osteopathic medicine on our Moodle page. I'm not going to give the full answer of the distinction, but it does more have to do with just the philosophy of training, how they go about doing that. DOs tend to more often, go into, family practice, internal medicine, pediatrics, general surgery, more general fields, but they can match into very specific ones. So that's just more of a general thing, but they're both great medical schools. We have both of them in the state, and we encourage you to read more about the MD versus DO experience. There's 3 MD schools in Louisiana, which is the 2 LSU schools, New Orleans and Shreveport, and then Tulane, which is private. And then the osteopathic schools in Monroe on the campus of ULM, but the school is VCOM. It's one of the VCOMs. There's 4 of them in the country, but one of them's in Monroe, and that's a private school. But they do love people that love Louisiana, since that's where they are. So check those out. But that's one thing to think about if you're medical. If you're a dentist, there's only one philosophy of training there, so that's going to be a little different for you. You just know you want to go to dental school. So you figure that out, right? You're like, all right, I want to apply to allopathic and osteopathic, or just one of them, or I want to apply to dental school, I want to apply to optometry school, I want to apply to podiatry. Now which one should I apply to? Well, then we talk about, once again, the American international distinction. And so before we get into which American schools, there are some international schools out there. And so we just caution you, if you're interested in an international program, look at their match rate for residencies, because you can get an MD a lot of places, but make sure they match well. There's a lot of schools in the Caribbean. Some of them do not match into American programs. Some of them have a great match rate into American programs. You being an international applicant, you will, if you're with one of those, well-successed programs, you will get a match in a residency most likely. But keep in mind, you are international, so you might get your second choice of location or your second choice of specialty. Typically when you're international, you have an easier time matching, in a internal medicine than say dermatology or something like that. So just keep that in mind. Look at those match rates. That's very important. But there are 2 international programs that are just as good match rates as American schools. We have a medical school as well in New Orleans. We really have 4 MD schools in Louisiana. There is UQ, University of Queensland, Ochsner. So that's a 4th medical school. You do your first 2 years in Brisbane, Australia. Then you do the next 2 years of clinicals in New Orleans or Baton Rouge through Ochsner. They've got really good match rates. So it's not, you're not like the other international programs. There's also Columbia University has an international program as well, where you can do work in Israel. So if you're interested in the internationals, we would say look at those first. But if you are going to go to international, just make sure you're looking at match rate, look at specialty, talk to the schools, that kind of thing. So that may not have helped any of you, may have helped you a lot, but now you're down to this next question. You say, okay, I know I want to be a dentist, no, I want to be a physician. I know which, MD versus DO or both I want to apply to. I want to apply, okay, I know about international, but what American school should I apply to? So the next thing to think about is the public versus private distinction. And so this is important because, a lot of you guys that applied for undergrad, a lot of out-of-state schools willing to accept you, no problem. Maybe tuition would have been more, but they'll accept you. Well, public schools for medical are different because there's very limited spots. And so when it comes to private schools, typically there is no funding that comes from the state. So that while they may, try to take some in-state students as a preference, for the most part, they take the best students because they're taking the best students they can with private because they have no financial obligation to the state. Well, when it comes to a public school, typically, anywhere from 30 to 100% of the spots could be reserved for in-state students. This is because, for Louisiana, for example, we don't want a bunch of people, you and I, we're paying taxes in Louisiana, and that taxes helps pay for the public medical schools. And then we need physicians around here. Well, if we had people from out of state come in and get half off tuition for the medical school, but then right after medical school leave and never come back, well, then we've basically, paid for tuition for physicians who would never, lived here for too long and didn't serve here. So the state does preference in-state. Mississippi, for example, you have to be a resident, 100%. LSU, Shreveport, for example, they reserve a minimum of 75% for in-state. So keep that in mind. If you're applying to if you're applying to a private school, you don't have a preference as an in-stater, but you're also not preferenced against. If you're applying to a public school, if you have that residency, you're preferenced for, you have a better chance. And if you're applying to an out-of-state public school, you have a worse chance, a harder chance of getting in than those that are residents. And of course, you can move somewhere, maybe work there for a year or two, establish residency. That is more time, but that's one thing to think about. The other thing with public is it is going to be cheaper if you're a resident. So once again, taxpayer funded is going to make that tuition cheaper. So keep that in mind if you're a Louisiana resident. LSU, cheaper tuition than Tulane, for example, because, it is a public institution. Once again, out of state is going to be like that. So those are some things to think through about that, but you don't need to be blind with, what those numbers are. There's actually some great resources out there for you guys to see what schools are public, what are private, and what can I make it into these schools. And so I want to just show you a few resources out there. The first one I'm going to show, which we've shown in previous episodes, is the MSAR, medical school admissions requirements. This is for allopathic MD, American schools. And so, here you're going to see if you buy this subscription, it's about $30, or if you meet with one of the pre-med advisors, Robbie or I, we can show you any school you want to see. But, you're going to see basically that you can look up a school, see LSU New Orleans, you can see there, okay, they take out-of-state students. But then you can also click on the school and see what those numbers are. And the med schools actually give you the exact numbers. And it's good to look at the interview. So what's the percent chance you get an interview as an out-of-stater? So see, in-state, 396 out of 684. That's over 50% chance you get an interview at LSU New Orleans as an in-stater. As an out-of-stater, there's only a few percent chance. So, definitely want to check out for other schools that way. and see also, are you in the GPA range? This is the median. You have the 50 percentile, middle 50%, middle 80%. And you can also see that for the MCAT as well. So those are helpful things to see. And also you can look at tuition as well. And the last thing I'll say just about this is you also look at, the mission statement. What's the school all about? Why do they exist? What do they value? What kind of students are they looking for? What other outside programs and activities do they have? These are all important things to look at. What are their match rates, and what are some of the specialties and experiences you can have? The final thing I'll say here is just kind of these two questions to ask. The first one is, can you get in? And that's a good realistic thing to think about, because you want to look at the numbers. And then on top of that, then if you can get into a school, or it's possible, then the question would be values. What's more important for you? Is it geography that's more important, where the school is? Is it money, limiting tuition? Is it the mission state or the match rate of the school? Is it the student experience? So you've got to figure out your values, rank them, and that'll help you rank the schools that you get into. We just always encourage you, don't apply to any schools that you would not go if that was the only school that you got into. Now that kind of goes without saying, but the idea is that if you apply to school A, B, C, and D, you only got in D, and you're like, what, I'm going to turn down D, and then give a good chance for A, B, and C next year. Well, then don't apply to D. If you're okay with D, but you'd rather have A, but you won't get into D, well, then go to D. So that's kind of the idea there. But the MSTAR would be helpful with allopathic, with dental. You can get this ADEA official guide to dental schools. You can also look at individual websites of the dental schools, contact them if any questions. And then you have the DO Explorer. This doesn't give you as much admissions data, but it does give you tuition, that kind of stuff. You can click on their websites. You can see, okay, where are the schools? You can see what's close to us, learn more about it, application deadline, that kind of thing. So, use the MSAR, use the ADEA official guide to dental schools, use the DO Explorer, also use the admissions websites, and use your pre-med advisors. That's what Robbie and I are here for, to help you along the way to make that decision. But just keep in mind, whatever schools you apply to, that's going to be more money and more time. So, think strategically with that money and time about schools that you can get into and you actually want to go to. And we want to help you along with that journey. So there's a lot more we can say about that. We do encourage you to follow up with an appointment, but, our mindset is, take time, do your research, figure out, be honest and realistic with yourself, figure out your career goals, talk to those schools individually about, what the student experience is, and, maybe even visit the schools if that's what would be helpful for you, because you're going to be there for 4 years. And you want to make sure it's a place that you're excited about. And if you have the opportunity where you get into more than one school, you want to be clear about, what that decision, would be and how to get there. So that's my quick overview about what schools to apply to, but I'm sure there's a lot of questions and a lot of things to answer. So I'm going to open it up for Mr. Bowen just to ask any questions that may come our way.
Yeah. So the first question is really about how many schools to apply to. Like, is there a recommended number, or, how do you tell people when they ask how many schools should I apply to?
A really great question, and it's obviously going to be different for everyone else. But keep in mind what I said before. Every school, if you have the fee assistance program, that program, which we talked about before, through AAMC, you can Google it, AAMC fee assistance. If you meet the qualifications, they will pay for 20 medical school applications. So if that's the case, then it's just a time issue. That's 20 that's 20 secondary applications to fill out after you fill out your primary, plus interviews, that kind of stuff. So 20 we would say was the maximum. That is a lot. That's not what we'd recommend, but that is what you could do with the fee assistance. Typically we see around, students applying to 5 or 6 schools. Some students apply to 1 school, and that's totally fine too, because obviously says you only want to apply to schools that you think, you'd want to go there, and you think you at least have a chance of getting in. And so, definitely work with us to figure out those values and really cut it down to the list of schools that you think you can handle.
Yeah. So a thing to consider there is not just, the timing, obviously, because it's going to take you a long time. If you're applying to 10 schools or 20 schools, I mean, that's a long time filling out secondary applications and all of that stuff. It's also, you want to keep in mind that with COVID, most of the interviews have been virtual, but at some point, you do have to travel to the schools to interview. So it isn't just the actual application costs. There are lots of other costs that are involved as well along the way of application. So, you know, you don't want to waste your time, your money, and your effort on a pipe dream of a school that you have 1 in a million chance of getting in. It's better to find the schools that you feel you're really competitive, or give your effort, put all your focus and effort there, because that's where you're going to have the better chance of getting in. So the next question is about the Caribbean schools. Like, if you choose to go to a Caribbean school, what are the some of the disadvantages, or is it a struggle to get into residencies if you do Caribbean school, that type of thing?
Yeah, it's a great question. So, every Caribbean school is not the same. So you got to do your homework, because there's some Caribbean schools that are there that are have some great match rates, a lot of success. There's others that do not match, in the U.S. And so you need to really make sure you're doing your homework. A few things to think about is, typically it is going to be more expensive, because, it's not going to be funded. Just tuition is going to be more expensive because it's not, funded by the states. Different grants we have, or, whether it's a public school. And there's other expense, of course, of traveling down there, so you're going to be flying down there. Things are more expensive on an island. So, maybe you have to ship it down there. So it's going to be a little more expensive living experience. Now, of course, it's going to be a beautiful place. So you might not have to vacation. But, you also want to look at, what kind of physician do you want to be, and where do you want to be that physician? Because, there's some, you can definitely match, with the Caribbean school, of course. And, there's many Caribbean schools that have great matches, but just keep in mind, it might not be, this exact residency program you want, whether it's specialty or this certain geography. So just keep that in mind, that your clinicals, you might have to move around, that 3rd and 4th year, you might have to move around a little bit. They might not be in the same place. You might do some work in Connecticut, some in Florida, some in New York. But if you're willing to, do a little bit of moving, okay, take on a little bit more debt, and then you're open to matching in a residency that, maybe would be, a place that you're new to move to, or, you want to go into a specialty that has a lot of pretty good match rates. That's definitely a great option. And definitely you can be a very successful physician going to Caribbean schools.
Yeah, there are definitely, some that are, very reputable. And you always want to be careful, and you always want to, ask questions, like, can I do my clinical rotations in the US? And also, like, pay attention to what they say, because sometimes they'll say our pass rate on the on the step 1 or step 2 is like 80, 90% or whatever. But is that first time attempts, or is that somebody who's had to take it 5 times to pass? So just little subtle things like that. The reputable schools are going to be honest. They're going to be forthcoming. They're going to tell you their placement rates. They're going to tell you their pass rates and all of that information. But if a school's not really giving you that kind of information, maybe that's a red flag that, that's not the opportunity for you. So, so this one's about trying to make up your mind between a different health profession, and, like, can you apply to medical school and dental school, or a medical school PA school? Like, what can you do both at the same time?
It's a great question. This is a question we get a lot of times. Someone might reach junior year and they say, "Man, I'm kind of interested in being a dentist and a doctor. I'm kind of torn. I might apply to both schools, take the MCAT and DAT, and then just see which one I get into." This is something we would not recommend. When you go through the admissions process, they want you to be 100% sure that you want to be a dentist, you want to be a physician, because if you get into that school, you're taking somebody else's spot. And so you're, if you quit that career after 5 years, then that's one less person that they accounted to being in the field. And so you're probably not ready to apply yet if you're not sure which one you want to do. We'd say go back out in the field, go be around a dentist, go be around a physician, figure out which one you want to do, take more time, and then maybe apply the next year when you are sure of which one you want to do. Because when it comes to that personal statement, it comes to for the interview, if you're shaky about it, that is going to come out pretty clear. And they really want people that are determined that they want to go into that specific profession.
Yeah, and sometimes I'll hear a student say, well, I think I have a better chance of getting into dental school than I can to get into med school, or vice versa, or whatever. It's not really that's not really true. I mean, I think you have to be competitive and a strong candidate, and they are going to be very focused in interviews, making sure that this is what you want to do and that you are committed to doing that. If you still are kind of debating, they have, thousands of other people who are 100% sold on this is what they want to do. And, they're going to not want to take a chance that you're going to change your mind in a year or two. And I think what you're going to hear, if you apply to both, I think what you're going to hear from both is go figure out what you want to do. And then once you have decided, we're happy to consider you or talk to you. But, if they know that you're applying to med school and dental school, you're going to have a hard time in both situations. Okay, the next one is about trying to be a competitive applicant and going to nursing school or becoming a PA, and then trying to apply to med school, as using that as a improvement on your application or making you a more competitive applicant.
Yeah, it's another question we get a lot. Someone says, well, hey, why not get my bachelor's in nursing instead of biology? And then that would be more specific. Once again, this is something we also caution against. You may know someone who went to nursing school, was a nurse, and after the fact, they decided they want to go to medical school, and that's a different story. But if from the beginning, if you set out to go to nursing school, once again, you're taking someone's spot in nursing school because it's also a professional school. It just happens to be at a bachelor's level, but you're taking someone else's spot who wants to be a nurse, and then you won't be a nurse anymore, and then you're going into medicine. So we say, if you want to go to nursing school, you should only do that if you plan on being a nurse. If you want to go to PA school, only plan on doing that if you want to work as a PA. Those are supposed to be terminal degrees. Of course, you can, as a nurse, you can go on and, get your doctorate and become a nurse practitioner and continuing as a nurse in the field. But yeah, we really, do encourage you guys to, when you go to professional school, that you're determined to stick with that profession, because otherwise, if you got in, you would take someone else's spot. And now we're going to have one less person in the field.
Yeah, and I think the professionals at these training programs or these schools and people in the field, I mean, they're passionate about their career, and they want people who are passionate about it also, that they're educating. And so, the viewpoint that, that's a stepping stone to something else is not going to go over well to people who are passionate about their profession. And so, yeah, I think that, there are other ways to improve the competitiveness of your application without spending the time, the money, the effort, and, as Matt said, taking away someone else's opportunity who truly does want to do that. We do have people who are nurses. They've been nurses for several years, and they at that point decide, I do want to go to med school, and they usually do very well. But it's not something that they go into nursing school thinking that this is my open door to med school. That's very different situation. So, okay, so the next question is really about like early decision. The person's asking, if somebody says, I really want to go to some particular school, is it worth it to do early decision application?
Great question. You guys may have not heard of that wording before, early decision. And, let me, as an aside, just say it's not as good as it sounds in one sense, because even though it's an early decision, you don't get to medical school any quicker. So just keep in mind that it's not a fast track way to medical school. You're just having the school decide early. So here's the catch about early decision: is you can only apply to one school. So if you're someone and you're unsure, you want to apply to more than one school, early decision is not for you. It's only for someone that says, there's only one school I want to go to if I apply to medical school. And I think I can get into it, because that's the second one, is that you're also jeopardizing your chances, right? Because you're going exclusive. You're saying, I'm only applying to school ABC, not to any other ones. And you're not allowed to apply to other schools. You have earlier deadlines. You need to have everything turned in by August 1st. And then they look at you and they make a decision on you of whether they'll, accept you or not early. Now, the advantage of this is that, if you are we only recommend to do it if you're at or above their average for at least your academics, but really well-rounded. If you're at or above their average, then you should apply. If you're below their average, but you still could get in, apply early. Just don't apply for early decision, or you're sending it in early. You're just not making them decide early, because therefore you can, then you can apply to multiple schools, that sort of thing. Now, the thing is there, if you do not get into early decision, you never are told, no, you're not accepted. You're just told, okay, you're not accepted for early decision, we're putting you into the regular admission cycle. At that point, you could apply to other schools if you got rolled into the regular admission cycle, but that would be October 1st, which would be very late. And you can go back and listen to our timeline episode where we talk about the importance of applying early to medical school for a good chance of getting in. So yeah, early decision is great for you guys who say, I only want to apply to one school. I'm at or above their average for MCAT and GPA. And, I would like to find out early if I'm in. And then what happens is you turn everything in by August 1st. They give you a decision back. And if you're accepted, they say you're in, and you're in by October 1st, your senior year. And then you can, sit back, relax, work hard in school, still keep it up, but know that you have an admissions decision. Now, we do have a lot of students who applied early, but didn't do early decision, and they already got accepted in October. So don't think that, if you don't do early decision, you're not going to find out till the next year. Early decision is not for everyone. It's not as good as it sounds, but it is great for those that are exclusively applying to one school and very competitive.
Yeah, I think the name sometimes throws people off, because who wouldn't want to hear early that you got accepted? But the obligation there is one school only. That one school has the time to decide if they want to take you through early decision or not, and then only at that point where they are not accepting you can you then go and apply to other schools. So I'm always asked students, why do you want to do early decision? And sometimes there are definitely valid reasons, like I'm married, and my spouse has a job here, and I need to be in New Orleans, for family reasons or whatever. But when somebody says, oh, I just want to be in New Orleans, I don't really want to go to Shreveport or whatever, that's a different thing, because then it's or do you really want to be a doctor, or do you want to live in New Orleans? And so, sometimes those are different things. So, it's a personal choice. It's something that you can decide on, but just also remember that you are obligated. If you do get accepted through the early decision program, you can't then at that point say, oh, I think I want to go somewhere else. It's an agreement between the med school and you that it's one school only. August 1st deadline by you, October 1st deadline for them to let you know, and then you're obligated to go there. So just think about it. Do you want as many opportunities as possible? Do you want as many open doors as possible, or do you want to really put sort of everything all focused on one particular school? So I don't know if we have. I think that's probably about it.
Yeah, we're out of time. We try to keep these things 30 minutes for you guys, so you can listen to them. We encourage you to listen to them while you're, working out, while you're, driving, whatever it is. We want this to be a resource that you guys can listen to even on the go. And of course, you can email us any questions to follow up. You can schedule an advising appointment with us. We open our pre-med advising appointments on Friday mornings. And just because we're doing a topic on a certain, medical experience, this, that, you can ask any pre-med questions, pre-dental questions, pre-optometry questions at our Wednesday meeting. So feel free to join and ask other questions that aren't relevant to the topic. But hope you have a great day. Thanks.
If you have any ideas for us about topics, again, as Matt said earlier, let us know. We want to make this useful. So if there's something that you want us to cover, send us that recommendation, and we'll try to make that happen.
Thank you, and see you guys next semester.
Bye-bye.